Hi, everybody. I made it. Welcome to the third general body meeting where we're going to have Dr. Andrew Niehaus, who is also our advisor, speak to us about some large animal cases. But I do have a couple quick announcements just before we get started. So our Chipotle fundraiser that you guys have been seeing in the emails is going to be October 4th, the Wednesday before the next general body meeting. And then we also have the Sea-Based Career Fair, so that's happening tomorrow from 1 to 5 p.m. in the Fawcett Center. So you guys can definitely check that out. We also have the Towers Agricultural Honorary Second Sale on October 10th, which sounds amazing. From 11 to 2 p.m. I'll be open. And then just a reminder about dues. You guys have been seeing them in the emails, so this shouldn't be a huge shock, but they're due October 11th. Teresa's your gal for that one. And then Adriana is also still accepting any of the letters to yourselves that you guys will have, or still are interested in doing that. We definitely encourage it. There was some point value associated with that. And then we do have something, we're doing a little bit of a PDMA census. So Marissa has put together a Google form so that we can get to know what our general body looks like. We're not going to give you the QR code for it yet, so but we'll get that to you at the end of the meeting. This is going to be really valuable because we have a lot of different diversity in here, and we'd like to highlight that majors. I mean, it's all over the place. There's a bunch of different information out there. So we'll give you that at the end of the meeting. For right now, I will go ahead and I will pass the pause so that we can get Dr. Andrew Niehaus introduced.
The Chipotle fundraiser is for the EB meeting, not the general body meeting. So if you guys want to come to the executive board meeting and bring some Chipotle with you, that's what it is, not general body.
And it's also happening from 5 to 9 p.m. So you have a really big window to get your food, and that goes to contributions for the club so that we can put on awesome events for you guys. So please go get some good food, feed yourself, take care of yourselves. All right. All right. All right, so like Grace mentioned, Dr. Niehaus is here. He is a part of the OSU Pre-Veterinary Medicine, and he's going to talk to us about some large animal cases.
Thanks, guys. If I venture away from this mic, can you guys hear me, or do you want me to wear my little lapel mic? This okay? All right. I'm sure that's fine. Bring.
Oh God, what? Thank you.
How's everybody doing?
Good. I don't trip over the little sticker that just says we need to stand 6 feet apart, I'll be okay. I trip over it like every time I left here. It's like peeling up and very But yeah, for those of you guys that don't know me, I'm Andy Niehaus. I know I've met several of you here a week or so ago when you guys we did a little tour of the large animal thing. If you guys couldn't make that, and this is the first time I'm meeting you. Hi, it's good to be here with you tonight. I am a clinician in the farm animal hospital. So our veterinary medical center is actually a breed hospital kind of under one group. We've got companion animals on one side and one on one side, and we're standing just in the middle of farm animal. We treat everything else. It's not a dog, a cat, or a horse. So kind of a little bit of everything. Just a little background on myself. I grew up on a farm. There we go. All right. I grew up on a farm. So this is my parents' farm right here, nestled in the hills of West Virginia. So just outside of Wheeling, West Virginia is where I was born and raised. And we had about somewhere between 30 and 50 head of cattle, depending on the time of year. And you can see them, if you look real closely, you can see them over here in the kind of far back here, kind of underneath that cluster of trees. And that is what got me interested in veterinary medicine. And I just loved the farm. My parents are actually both school teachers, public school teachers. And they did farming on the side, kind of like a little hobby farm, but that really got me interested in veterinary medicine, helping out with that. And my dream, my goal was to basically do what my parents did on the farm, except instead of being school teachers and having a part-time farming gig, I was going to be a vet and have a part-time farming gig. And so that was my kind of motivation in life. And so I finished high school and was looking for colleges. I figured, well, I'll probably, go somewhere and major in biology or that type program. And then Ohio State was my school that I wanted to go to, and that was kind of my plan that laid out. My dad was like, well, you really like math and science, maybe take a different route. And so I actually went into engineering. So I majored in undergrad. I majored in chemical engineering at West Virginia University. So I went there and looked at the prereqs for vet school. And I'm like, well, you don't need anything specific except some, prerequisites, but no like specific degree. And so that was kind of the route that I took. So kind of went a long way around. And my senior year in undergrad, I actually had several friends that were doing other things. One friend from Chemie was going into law school and a couple med schools, and I was like the only vet school in my class. But I still wanted to do it, and so I'm like, yeah, that's I think what is for me is veterinary medicine. So I applied. I got into Ohio State, and I came here. Goal was to spend 4 years at Ohio State, then I was going to go back home, right? And I had everything planned out. This is what I wanted to buy. I wanted to buy this truck. Maybe not this truck, but a truck with a vet unit in the back. And I was going to drive into the sunset and treat cows all across West Virginia, right? So that was my goal. Well, I did all those 4 whole years of that school year. And in my very late, the 11th hour of my senior year, I still didn't have a job. And I heard of some opportunities that opened up in the clinic, and they needed to fill a position. And I went out and talked to some people, and they're like, well, you don't qualify because you need to at least stay out a year, do like residency as the program. And they're like, but if you want to, maybe we could do an internship and you would just be a 1-year thing. And I'm like, oh, that sounds perfect. Actually, because I've been doing this my whole life. I don't want to stay at university forever, but I've been doing this my whole life. I can do anything for another year, right? So I stayed and did a year of that. But then I really fell in love with teaching. And maybe it was in my blood because my parents were teachers. I never thought that I'd ever be a teacher. But that's what I think is really fun about what I do. And in addition to treating the animals that I treat. And so I stayed here for just a year, what I thought was going to be a year, which turned into a 3-year residency, which is more specialization. And I specialized in large animal surgery, which was really fun too. And I got to stay in what I thought was the greatest section of the hospital with the food animal and teaching food animal stuff, teaching residents and interns and more students. And then there's a faculty position that opened up, and I have been here ever since. So I came here in '99 thinking I was going to spend 4 years, and I've never left. So it's kind of my story. It is fun. I enjoy my job. Every day is, I kind of have to tell myself, not that there are parts of my day that are like, wish that didn't happen, but it is really fun, and every day is different. And that's, I think, another great thing about the profession, no matter what, really, it's a profession that's full of different things, and you can do so much with a vet degree. And I guess in closing with that little intro spiel, don't close your eyes to opportunities of veterinary medicine that you may not think are for you. Because I never thought staying in a big institution for teaching was what I wanted to do, but it worked out really, really well. So I'm happy to talk to you more about that. But I've got some cases if you want to talk about some food and stuff. So these cases that I put together actually came in a few years ago. I can tell how. Because everybody's wearing masks.
All right, so that dates the cases now. So this is sometime during the COVID mask thing, which I guess went for like 2 years. But they're a couple years old. But anyway, this is a 1-year-old Jersey bull. Okay, and I think this bull, did it come from the bull stud? It may have come from Select Sire's bull stud. I'm not sure. We get a lot of stuff from them. I'm not sure if it came from them or not. But anyway, it's a 1-year-old Jersey bull. And it was presented for bloating for 24 hours. So it's bloated for a day and not eating, which isn't surprising. When they're bloated, oftentimes they don't eat very well. And the owners, and perhaps us too, but the clients or the place where it was, they tried to relieve the bloat tube. It's actually really common, and take a rigid tube and pass it down their esophagus, and with the hopes that the gas would come off, right? And they would decompress. Turns out there's a couple different kinds of bloat. Does anybody know what the different kinds of bloat are? Have you heard of different characteristics of bloat? So one's a free gas bloat, which is where there's just a big gas bubble in there. What compartment that makes the bloat? There's no anatomy. Yeah, and have that. So, you know, the kind of 4 chambers of the stomach of the ruminant, that's the big one. Right? Hence the name ruminant. And so usually bloat is caused by distension of the ruminant with gas. Not really overproduction of gas, but it's something that prevents them from being able to burp that gas or erupting that gas. And so we always try to pass it too, because some bloats are caused by just pure gas in the room. And if you pass the tube into that, it just, then they decompress. It's actually really, really cool, because bloated animals can get really, really sick. And especially ones that get really tight because they can't breathe. That rumen, all that pressure in their rumen and their abdomen pushes on their diaphragm and they can't breathe. And so it can be an emergency type situation. And so they tried to pass the tube, they were unable to get it out. And so that tells me that this is a different kind of bloat than free gas bloat. It's another kind of bloat. Does anybody know what kind that is? It's not free gas. Yes. Frothy. Excellent. So it's frothy bloat. And frothy bloat is a type of bloat where it's like a foam inside the room. And unfortunately, the problem that creates is that does not come through too very well. Doesn't come through their esophagus very well either. They don't like to burp up that foamy type of ingestion. And so that's what causes them to bloat up. And usually frothy bloat, it can be caused by different things that they can eat that basically cause the foam to form when the rumen churns. So the rumen's just not a big balloon in there, right? It sits there, it's constantly moving. And certain things that they eat will create kind of like this protein layer of the rumen, and it's like having real thick chocolate milk and blowing bubbles in it, and having those bubbles kind of froth up to the top of the glass. Versus with water, if you blow bubbles in that, it's not going to froth up, right? No matter how long you blow bubbles in, it's not going to froth up. But you take this really thick kind of viscous type of substance, you blow bubbles and it froths up. Kind of the same. And so this rumen is always in normal rumen, kind of moves back and forth, and that's what kind of creates this foam. But it's in combination with certain things that they eat and changes the characteristics of that ingestion. Some other things that can cause frothy bloat, sometimes they can get neurologic problems, and that actually makes their stomach churn more. Or it makes it so they don't want to eruptate that, and they don't want to bring that gas up. And so there's a bunch of things that can cause bloat. But we know that if they try to pass the tube, it would pass. So we're thinking, what do we do now? And it wasn't passing very much in the norm. It had a history of respiratory disease, and I think that's important when we go to diagnose this and try to figure out what it is. And there was some pathology in the lungs. They did an ultrasound of the lungs,
at the place where it was before, and they noticed that the lungs not look that it didn't look healthy. And they did have a history. This cat also had a history of previous, and they did a ruminosity. Who knows what a ruminosity is? Yes. So the answer is when you sow the rumen in the body wall, create a good seal, so we don't get leakage of rumen contents into the abdomen. It's contaminated, right? And we don't want that to get in the abdomen, so that'll make it sick. Then we cut open or cut a hole into it, and that allows the gas to escape. There's a few different ways of doing it. But they performed a ruminostomy, and this ruminostomy, they actually put a plug in it, and I'll show you a picture of it later, but they put a plug in this, and then I think they ended up taking it out because the cat wasn't bloating anymore, and this ruminostomy had closed up. But it did have this history that are in blood. So we did some stuff. Who would like to, if you guys are the vets, what would you do in this case? Any thoughts? Induce diagnostic, we will sure do the treatment. We can say, I have no idea, I need to call a vet. It's sometimes you're gonna get there. When you guys see your first case and you're there, and we've all been there before, where you're presented, you're out there, graduated, and you're on your own, and somebody brings you an animal, and it's like, what do I do? And when you're faced with that, the best piece of advice that I can give you is don't ask. You know what to do. It's in there. Okay. Even if you don't know what to do, and there's an art. There's an art, and we'll hopefully teach you that as you progress through vet school. There's an art to know what to do when you have no idea what, and like how to approach these cases, because you're going to be there. I'm there all the time. Actually, it's like I have no idea what's going on, and somebody's wanting to do something. So we actually did some more diagnostics, and we did some blood work, and this was the blood work printout that we got. And I don't expect you to know all the values, but there's actually some pretty significant values here. And one of the things that we look at is the chloride. And the chloride in this thing is really low. Does anybody have an idea what that may mean? I didn't know what that meant when I was sitting in your shoes. Probably didn't even know until I was about ready to graduate vet. But the chloride is hydrochloric acid is produced just like it's produced in your stomach. It's actually produced in the abdomen of a rumen, not the rumen, but the abdomen. So that last kind of stomach, but more the true stomach, right? So it's analogous to our stomach. And normally that hydrochloric acid should be produced in the stomach, and then that chloride gets reabsorbed later on downstream. And so it goes back in the bloodstream, it's kind of recycled. If they have an obstruction and stuff's not moving through their intestine, that chloride doesn't get reabsorbed. It actually accumulates in the abomasum, and it might accumulate in the rumen, but it doesn't get reabsorbed through the intestines. And the blood chloride will actually be, what do you think? The blood chloride, because it's getting stuck in the rumen, it's going to be low, right? Rumen chloride is going to be high, and it's going to get suppressed there. And so we run this, and we see this low chloride, it's like 80 something, and it's also pretty well alkalotic, which means the blood is more basic. And it should be like a 7.4, it's like 7.5, which actually you might think it's only like a 10th off, but it's actually pretty significant. And also it's CO2 is high in its bloodstream, which probably means it's not breathing very well and blowing off that CO2. And so we have several things that are shown here, and it looks like it's kind of dehydrated, so creatinine's a little high. Yeah, not something that I expect you to know, but realize that it can give us a lot of good valuable information. So now it's like, okay, what do we do with this animal? What do you think? So there's signs that something's obstructed, this thing's bloated. So what do we do? What's that? X-rays, good, okay, we can do X-rays, yeah. And so there's a lot of things that we could look at on X-rays. One thing, do you guys know of anything that cattle get that we might be able to see on X-rays that could cause them to bloat up? Yes.
Hardware disease.
Hardware disease, good, excellent. And so that is one thing that hardware disease, if you're not familiar with it, it's where so we talked about abomasum already, we talked about rumen already. What are the other two stomach compartments? Omasum and reticulum, good. And so the reticulum, also known as the hardware side, that can have nails and wires that go in there, right? And it just accumulates in there. And probably most of the time they just sit in there and they don't cause a problem. But sometimes they can actually poke through the front of the reticulum and it can cause infection or parasitis, cause an abscess, and then cause these animals to get bloated. And so I think the X-rays would be something that would be very diagnostic, really useful. We could also, along those same lines of imaging, we could do an ultrasound. Sometimes we do that more commonly because there's, in addition to kind of seeing like abscess and peritonitis around the area of the reticulum, we also can see more motility because it's real time. We can see things moving. While you have the proton evidence, that would be something else that we can do. Is there anything else we can do? This is not. And so another thing about veterinary medicine is just because I manage the case one way, doesn't mean it's the only way to manage the case. But because somebody else, money, you guys manage the case one way, doesn't, and I do something different, doesn't mean the way your way is wrong. And there's a lot of things, you don't have to be able to justify what you're doing. Have a reason, always have a reason for why you're doing what you're doing. And it's okay, even if you do it, and sometimes you do it, you're on diagnostics like, well, that didn't help us any. And that comes with experience, is which diagnostics are going to be most useful in given situation. I don't think we did X-rays on this, but we might have, and it wouldn't, certainly wouldn't be wrong to do it. Any other thoughts? I think we did an ultrasound, kind of looking for some of those same things, and we didn't see anything around. But is there anything else you want to do? Yeah, exploratory. I like exploratories because I'm a surgeon, and surgeons like it. Not saying that it's right in every situation. Sometimes it's contraindicated. But an exploratory gives us an option. It can be a diagnostic. Gives us an option of going in the abdomen and seeing what's in there. Okay. It also gives us an opportunity, since we're in the abdomen, to fix what's in it. Right. And so I'm pretty sure that's what we did. We did an exploratory. And I think this is a video. Right? Yes. Oh, sorry. Hope we don't say anything bad. All right. So what do you think? So this animal presented for bloat. Okay. What structure is bloated? Or what structure, when they bloat, what structure is distended? Rumen. Okay. So did anybody know what side we open this animal up on based on what you're seeing? What's so so what side are we doing surgery on? So this animal's standing. Okay, it's standing, it's awake. And it's anesthetized. We have the flank anesthetized, so we numbed up the flank with some local anesthetic. What side are we on that gives this image right here? What are we looking at? Structures. Intestines, right? Small intestines, specifically. So we're looking at small intestines. What side do the small intestines like the liver? Okay, takers. I have a 50-50 chance. What side does the rumen like to live on? Left, right? The rumen's on the left. And if you open that animal up on the left, if you open a ruminant up on the left and left flank, guess what you see? Rumen everywhere. And so if we're doing an exploratory, most common, we do exploratories on the right, unless we think there's a problem with the rumen. Okay, so if we think there's a problem with the rumen, or if we need to go into the rumen for whatever reason, we open them up on the left. If we think that there's some other problem in the abdomen, we usually go to the right, because the rumen blocks our view of everything else and the ability to work with everything else, right? And so the left side or the right side is usually more versatile. Okay, versatile. Now, why would we have a animal? That is floating, and we know the rumen is what's floating. Why would we have opened this animal up on the right? And would you guys have chosen that? Anybody want to open, would anybody would want to open up on the left? Again, there's different ways of managing. I think you could argue that a left exploratory would have been a better thing to do, or a left side approach, because we think the rumen's floating. But is there any reason why we open this animal up on the right? Pardon me?
See the other side of the rumen floated.
Okay.
Why?
Yeah. So, okay, let's go with that. I know you're on your track. So the thing is, on the one side, you can, one way you could argue it is that, again, it's way more versatile. There's way more things that it's a C on the right side because the rumen blocks everything up. Especially the floating ring, it's really descended, right? And so the right side is more vertical. Is there a way to explain right-sided problems causing a descent rumen on the left? There is how. Yes.
Is there blockage in, as soon as we talked about the cord levels? So there's probably blockage in the intestine, so making it to the intestine.
Yes, thank you, very good, very good. So we've done blood work, right? And that chloride is really low. That suggests to me that there's a blockage, something in the last stomach, the abomination isn't getting downstream, right? And so I'm thinking there's likely a blockage, maybe in the intestines, that now the rumen's floated because everything's backing up, right? It's not getting down there. And so that was a big thought process in our mind. If it's just a primary rumen problem, like say she ate too much clover alfalfa, which is some of the things that can cause that frothy bloat type situation. If you just ate that and I would expect that chloride, right? And so if I just need to do rumenotomy, open the rumen up and get all that frothy bloat out, which I would have done on the left, would have explained everything. And so now I'm kind of thinking that maybe the problem is everything's sort of backing up. And so we actually open the salmon up on the right side, and I know that looking at this picture because these small intestines are on the left. They're on the right side, because the rumen is going to the left. So what do you think? Now we've opened this pull up, this cap up, and that's what what's your impression of what we have going? Thoughts? There's a lot of things that you can say. So what do you think? You're the vets, you're the surgeon. Look at this. What do you are you thinking? Simple things. So like just observation. Yeah.
I don't see any kind of large object or hardware.
Good, excellent. And I don't see any large let's just say obstruction causing it, because and you don't, okay, and so that's not something to see. Now, what's true of hardware probably wouldn't be here, it'd be more like at the reticulum, which we don't see yet, like true hardware disease. But I don't see a fluid body or like something inside the intestines that looks like it may be causing obstruction. What else along those lines do you not see here? Like what, like interpret this. What are the okay, yeah, yes.
It looks like darker.
Okay, I kind of wondered that too. It kind of looks like, I actually do think it's the video, but that did strike me as when I first watched this, and I actually haven't watched this in about a year, so I'm kind of learning with you here. But I sort of remember a little bit about how it turns out, but I kind of look like this is a little bit more darker than the rest. I think it's a little bit of the, that's a great point. I think it's a little bit of the shadowing, and I'll actually come back to that. What else do you notice? What else is really obvious? that we're probably pointing out. I know 3/4 of you are thinking, your mom. They're empty, good, that isn't actually what I was thinking, but that's a great point. They're, and I did want to make that point, they're not distended, right? I mean, when you're in exploratory, if you think there's an obstruction somewhere, guess what? You might expect to find proximal or orad towards the mouth of the obstruction. You have the obstruction here, your mouth, right? Your mouth, esophagus, stomach, intestine, anus, right? That's how it flows. You have an obstruction here. Guess what you expect to find here? That makes sense? You guys know where I take it right. Head, butt, head, butt, intestine. Head, butt, intestine, right? You have an obstruction here, close to the butt. This is the orad. This is what we call orad, right? Orad meaning closer to the mouth. Orad. What do you expect to see in the intestine orad to the obstruction? What? But like describe the intestines. Full, really full and big and distended, right? You guys know, you're not even in vet school yet. You know it's good, right? You guys find we don't find. They're empty. I think that's a huge find, right? Yeah, are these intestines dead? Why not? Yeah, they're moving, right? They're moving. And now I go back to that darker color thing. I think that's really a good point. Is this darker than the rest? This is moving too, I think. And if it's darker, the concern that we have with dark intestines, we look at color too, for all the time. And dark intestines oftentimes mean they're, what word? Dead, right? Dark, dead. And so pink intestines are good. Pink, good, dark, dead. Right? Okay. And so you look at it and it's like, is it too dark? Is it compromised? Usually before they die, they stop. Okay, just like other things. And so I'm looking at these moving and I'm thinking they're actually probably going to be moving because it's usually one of the first things to go. So I'm not thinking they're that much dark, like considerably darker. But why might they be? Is there? Oh, I'll just say they might be darker because they've probably been getting squished by the rumen. Right? The rumen is really big inside an abdomen. That's a finite space, and so that rumen gets bigger, things get squished. Even though they're not primarily obstructed, they could be getting obstructed because the rumen's getting bigger and kind of squishing everything to the side and keeping them. And so we see this sometimes. Even though there's not a physical obstruction because something's stuck in there, or a piece of intestine is twisted itself, causing a back up. If the rumen is really distended and really bloated, it can push these intestines and squish them against the wall. And now they can't be moving, and they get squished to the wall too hard, and they're going to start getting a little bit of blood supply that's lost to them. It comes back because it's not squished that hard. It comes back as soon as you open it, but it wouldn't be surprising if maybe it's a little bit darker than normal when we get it out. Does that make sense? So I wonder if maybe that was steps part of it too. But I think these are excellent findings. We know that these intestines themselves probably aren't the primary problem. Okay, and we found that out on Explorer. So I think that's really good. So we did it in Explorer. We did not find it. We didn't find any hardware disease, and that's another thing with Explorer is you can go down, you can feel the reticulum, see if there's any hardware disease there or any signs of that. We did that. We didn't find anything. We ran all these intestines. We felt through the intestines. We didn't find any evidence of obstruction, which is kind of what we thought might have been going on. We think the low chloride is due to the fact that the rumen was just so big, it was pushing on the intestines, and it was causing an intestinal obstruction, but it was causing widespread intestinal obstruction, so nothing is filled, and everything is backing up in the abdomen, and then it gets into a vicious cycle. And so that's, I think, what was going on. So now, once we find that, what would you do? How would you approach this case? Pardon? Open up the left side. Open up the left side. Okay. What do you want to do from the left side? I think that's a great idea. to just open it, have enough to explore from the left? Or do you want to do something with the room? Pretty much the only thing. Yes. Yeah. A ruminosity, I think that's a really great idea. Well, I'm just gonna kind of jump forward here a little bit. And this ruminosity was there, it was spawned, it was closed off. And I usually when I'm in ruminosties, I like to open them, kind of just open the rumen up, suture it to the skin, and then open the abdomen up, suture the rumen to the skin, create a little bit seal, and then open the rumen up to let it vent, or clean it out if we need to. I don't like using these little trocars because they leak sometimes, and sometimes you get peritonitis from that, and I've seen that as a complication. But in this case, because this ruminostomy was already there, and it was already stuck, the rumen was already kind of stuck to the body wall, and it was already creating a pretty good seal. And so what we did is we stuck a trocar in there. This is called a trocar. Okay, and it just goes in to relieve the weight of the rumen. So we're poking that into the rumen hard. Okay, it's hard, it's tough. And this thing's got a little corkscrew in it. The reason is that holds the rumen, kind of screws into there a little tight, and holds the rumen against the body wall, so that it's less likely to leak into the abdomen. So screw that in really tight, so we create a really good seal. And then, yes. All right, and then we pull that plug out. Here. Decompress. Going down. Oh, it's bubbling out. Yeah. So it's bubbling out there, and that's just that determined content bubbling out. It's kind of weird to me. And I don't have a good explanation for it. Sometimes in real life, I can't explain it. But I don't have a real good explanation for it. Is most of the gas taking off is free gas. Not sure why this animal did not decompress with just the stomach tube passing. But it didn't, and it passed with that. It didn't look like a lot of froth and stuff there, because I was kind of thinking it was going to be more of a froth, but it wasn't. Why do you think this animal, and this is what he looked like the next day and we saw, and it actually he looked a lot more comfortable. Why do you think this animal developed this problem? Is there anything in the history that suggests a problem with the rumen or can explain that? Actually, it has to do with another hypothesis. Yeah, somebody have an answer. Yeah. The respiratory disease, I think, is a real, I don't know for sure, can't prove it, but I think that history of respiratory disease produced pneumonia is likely related to this. And there's a nerve. Who has heard of the vagal nerve? Good. What does the vagal nerve control? It's what innervates the stomach compartments, right? And there's a condition called vagal indigestion, which suggests that if you have a problem, a severe problem with vagal nerve, sometimes you have imbalances in the motility of the stomach compartment. And sometimes it can be slower, or sometimes it can be more, and it can actually be fast. And that's what we call vagal nerve. We don't really understand it much more than that, except oftentimes these animals get bloated, and we don't really have a good explanation other than there's a problem with the vagus nerve and the stomach compartment starts moving, it doesn't have normal motility. Guess where that vagus nerve runs from and to? Runs from the head to the stomach. And guess what it passes in between? Guess what it passes to? Chest. And if they have really severe respiratory disease, that can affect the vagus nerve as it passes through the chest, and that can cause problems with this. And we kind of think that is what was going on. Unfortunately, there's nothing we can do to fix that specifically, but you can kind of treat symptomatically. Sometimes they get over it, treat the underlying respiratory disease, and hope that in time things kind of regenerate. Even getting bloated, hopefully this little ruminostomy or rumen cannula will help do that while we treat them for other diseases. And again, we cross our fingers, hope the vagus nerve repairs itself, if that is truly the case. So I thought that was kind of an interesting case. Hopefully you felt the same way. Some take-home messages. One is there's a lot of different ways to approach it. Two is don't be afraid to do an exploratory, says the surgeon. And there's not a lot of other take-home messages too. And then just how, right? All right, how are we doing on time? 10 minutes. 9 minutes. So this cow presents to you with a swollen foot. Okay, super swollen foot. What's your thoughts? What do you think's going on? And what are you gonna do? Yes.
Look for a wire.
Oh, look for a wire. Why do you say that?
So I watched it happen with another large animal vet.
Okay, good. You guys see this? What does this remind you of? Does anybody, any like people from the country? Like they have something that this looks a lot like. What's that? Overgrown halter, did you say? Like a halter on the nose? Yeah, for sure. That is very, very good, very, very good. Anything else? Like you're walking through the woods and you see something like where an old fence used to be. Stapled to a tree. Everybody's seen like wire stapled to a tree for a long period of time. What happens? The tree goes around the wire like that. See that? This is classic for a wire. Okay. And sometimes it's not real apparent when you look at that. Okay, and sometimes you dig around in there, you're like, I don't see any wire. We missed this before. We're like, oh, looks like a wire or a piece of twine or something like that wrapped around the foot. And you dig in this wound, and sometimes it gets so, I'm going backwards, sometimes it gets so proliferative, that tissue gets so proliferative around, it buries real deep in there. Okay, just like a tree growing out on a piece of barbed wire. So you have this, what are you gonna do? What would you do? How would you explore it first, right? Do simple things first, explore it, that's pretty cheap to do. When you explore it, is there anything else? If you don't find it, what can you do? Yes.
X-ray.
Take an X-ray. Okay. It's funny, one of the other vets said, do you guys know what cerclage wire is? Cerclage wire is orthopedic wire. If you have a fracture, like a split a bone and split, you can wrap cerclage around the bone to kind of like hold it together like orthopedic wire. So one of my other colleagues said, yep. The good news, or he said, the good news is this, I forget exactly how he said it. It was really funny when he said it. It was something about like, well, the cerclage wire, the bone healed, but the cerclage wire really loose because it should be tight around the bone, right? And so it's obviously not split. But look at this, look how deep, here's bone, right? You can tell the bone. And this is the soft tissue. Okay, it's there, here's soft tissue there. Look how deep that is. We didn't see this initially. I mean, we were groping around there, like, there's no wire in there. We're like, oh, let's take an X-ray, just to be sure. And sure enough, it's in there. So then we went in after, right? And so this is the piece of wire that we got out and broke in the process of getting out called rusting. But how lame do you think this cow was? Too thick. Should be extreme. Guess what? She wasn't hardly lame at all. The owner brought her in to us because she had a foot that was like 3 times the size that it should be now. Like almost twice the size. But big, right? They brought it because this thing was super small. And but she actually wasn't that lame, which tells us a few things. What would it tell you? Probably not wrapped around and hurting any really important structures, right? Like the joint, it's probably not involving the joint, which it wasn't. Here's the joint here, okay? There's one joint, here's another joint, here's another joint, there's 3 joints. This is the fat joint, okay? And then here's a passer, here's a coffin joint. And so it's way above that, that's good. Because if it was down here, I can almost guarantee you should be lying. There's also tendons and ligaments that go, or tendons that run down here, right? And it must not be involving those to the severe enough that's causing problems. She wasn't really that lame, but we went in there and took this out, and we sent her home. I don't know how she did afterwards, but I assume she did pretty well. She did pretty well. So, this is the last case that I have, and I don't have much time to talk about it, but, this is a longhorn. Obviously, that came in for an ear infection. Long for an ear infection, right? And so the owner said that they noticed, that it was kind of lethargic, and there was discharge from the left ear. And the referring vet, looked in the ear, which was kind of cool, looking in the ear of a longhorn. Better be careful, it doesn't like bore you with its horn, but he was super cool. This deer was super chill. And he looked in the ear and said that there was a left ear loose. And I looked in the ear, the referring vet is better than me, so I looked in the ear and I'm like, I'm not sure I see it. And so luckily for me, I've got a specialist that looks at ears all the time, dog ears, but they look at ears. And so I asked them to come down and look at them, and I'm like, yeah, they'll absolutely come down and look at the ears of this longhorn. So they came down, they had like fancy scope equipment and stuff like that. They're like, yep, there's a mask. I'm like, how in the world did the referring vet on farm see this thing? But he did, and said that there was ear mass in there. So I'm been treated with an antibiotic, and it didn't get better, and so that's why they came into us. So came into us, it was bright and alert on physical exam. Its left ear did have some sort of crusty sort of accumulation of stuff, probably because that shape was drying there, and it was more swollen compared to the opposite side. And so we saw this mass, or at least our dermatology people look for years all the time. Saw it. So knowing that, what would you do? How would you approach it? Dots? The vets. What's that? Well, back to me. So you want to do surgery, take it out. Good. Yes. Yeah, I mean, aspirate. I heard aspirate. Did you have something different?
I was using like text.
Okay, test the mass. I think that's actually what, oh, we actually did imaging. Oh, maybe I just asked imaging. If it was a small animal that had an ear, really chronic ear infection, how would you image it? To do X-ray. We oftentimes hear, because we can't, we do a CT, and even like a large animal in small ruminants, like sheep and goats, and sometimes horses, and sometimes cattle, we'll actually put them through our CT scanner. Unfortunately, for this bull or this steer, his headache up there. And so this was out of the question. And so we did actually do, we took a sample of it and we got histopath and it came back, so we did a biopsy of it. And I think our derm people helped us get a sample. And whether it was just aspiration or I guess they did a biopsy, because it said biopsy. And it just came back as like granulation tissue and thought it was infection, like due to chronic infection. We're like, well, that's good. At least it's not too in there, right? And so now, given this, so we got granulation tissue, probably secondary infection. What do we do? We decided to treat medically. And so we put this animal on antibiotics. Exceed, which is an antibiotic. It's a long duration, long acting antibiotic. It's broad spectrum. And we did that and it did okay for 3 months. It came back. And the owner reported that it did not have like massive improvement. And now he could hear sloshing in its head. Okay. And I'm like, how did you hear this sloshing? They're like moving the head around, but he said you could hear slosh, maybe like manipulated the ear, you could hear it squishing. And it was hallucinating. So they were concerned, they wanted to do something more than just antibiotics. So this was us trying to restrain the animal so it didn't get like knocked in the head, just a little bit safe thing. Yeah, and COVID, everybody's got masks. And Dr. George shoot and Dr. Allison put it there. And we actually went in surgically and opened this up just below the ear. And we tried to follow the ear down to thinking that we're going to do like an ear canal ablation. And we got into this huge abscess and took out all of the spots. We didn't even get into the bullet. I'm like, where is this coming from? Where is this coming from? And I was like, I have no idea where this could be, and there was just like all this purulent material is actually coming out. And then we went back to the good old skull. Now there's a skull in my office. And I'm like, here's the ear canal. Okay, that's where the ear canal is. And so the ear is there. And then I'm like, duh. Didn't think of the anatomy. Like, look at this big cavity. Here's the eye, right? The orbit. And the cattle have this huge, this huge cavity that sits right below, especially horned animals, where the horn kind of grows out, that sits right below their horn. And I think that this was just all assets, this cavity was filled up. And it resulted likely from an ear infection that ruptured out into this area and then formed a big, basically formed a big abscess. So this animal, what we did was we opened it up, we drained it, we put a tube in there. And that's this tube sticking out. We infused, after flushing that really well, we infused some antibiotics right here. And this guy did really well afterwards. Here's the tube just kind of hanging out. No more sloshing of his ear. And at least for the time that he was in the hospital and went home and actually did really well. And I contacted the owner not too long after we went home. And he was doing well there, but it's been a year or so, and I don't know if he's doing that. But he was a really cool, Brisket was his name, and he was a really cool student. Anyway, those are the only cases that I've got for you. Hopefully that was good. And yes.
What's normally in the cavity? Is it normally just empty?
There's a good question. So the question, what normally is in that cavity, and there's some soft tissue and some muscle and things that are there. But yeah, this was kind of expanded, meaning that the bone kept it from going into the brain and further inside medial. But yeah, it kind of stretched out all over the tissue. Great question. All right. Thanks, guys. It's been fun.